Good evening, everyone. Welcome to another series of Gut Over It. My name is Dr. Vivian Asamoah, and tonight I will be talking about constipation, the do's, the don'ts, and some easy tips to relieve constipation. I'm a gastroenterologist in Katy, Texas, and my passion and focus is functional gastroenterology. My aim is really to help those with chronic gut illnesses who haven't found relief through conventional medicine, diagnostic testing, and prescription drugs get a more holistic approach, integrative and functional medical approach to relief and restore their relationship with food, basically help them enjoy food again. In the month of February, I set this challenge to discuss a GI topic every night. I am leaning over the next 2 weeks, as it's my last 2 weeks, although I'm having tons of fun, guys, to talking about things that are of more functional medicine related, integrative medicine related, as this segues into our Facebook group, Natural Gut Relief, that we're going to be opening up privately soon, probably in about a week. And there'll be a lot more of these discussions, forums, interviews, and resources shared on those groups. So hopefully you'll join me then. Tonight, we want to talk about constipation. But before I go into that, I got to say something to my patients, because a lot of patients are concerned about their appointments. And I want you to know that we will reschedule everyone's appointment in due time. Our office has to remain closed for the safety of our staff, and also for the safety of our patients, not to drive in. A lot of people don't have light at home. They don't have power. They don't have internet. So bear with us, guys. We haven't forgotten. We thank you for thinking of us and keeping us in your prayers, as we are doing for you. But we hope to resume to normal activities when the city gets back to normal activities, okay? We'll put some information on our Facebook page every day about what's going on, but we are closed officially in the office tomorrow. I will be doing all the consults virtually. All right, so let's dig right into it. Constipation. I'm gonna get right into treatment, because at our practice, and basically with respect to what I do from a functional medicine standpoint, I do not like prescribing prescription medication. I do not like prescribing laxatives like Senecot and Cascara, especially if someone has already been using it for a long time, because I do strongly believe that you will develop sort of you kind of become hooked on it, right? And then you go from needing 2 pills to 4 pills to 6 pills to 8 pills, and there's no long-term relief. So our goal is to see if we can find the origin and the source of the constipation, and from there, take it from there. So let's talk about the 3 main types of constipation. Thanks for you guys all joining me tonight. If you're listening to this on the replay, please enjoy, put some questions in, leave some comments in there. 3 forms of constipation that we learn in med school. Number 1 is slow transit constipation, which is basically you eat a carrot, you see it come out of your stool like 5-6 days later. That is just a really slow transit that has something to do with the enteric nervous system, all right? Number 2, constipation, IBS predominant constipation. So these are people who typically suffer from some form of irritable bowel syndrome, a little bit of bloating, will have bowel movements, sometimes regularly, but very often we'll notice they skip 2 or 3 days. And so that's IBS predominant constipation. So it's not going for 2-3 weeks, which is similar to slow transit constipation. This is maybe skipping 2-3 days, which is an issue. And then finally, the one that a lot of people don't think about is pelvic floor dysfunction. So when I see patients who say, you know what, my stools are loose, I go every day, but I strain to go. And even when it's coming out loose, I am still straining to have a bowel movement. And so this is what we call pelvic floor constipation, pelvic floor dyssynergia, and there's treatment for that too, but it's very specific. So let's dig into sort of the normal things, and then I want to focus on everything that's integrative and functional medicine related. So I always tell patients, if you've suffered from constipation for a long time, you got to make sure you're watching your diet, okay? It's all about fiber. Not fiber so much through carbohydrate fiber like wheat, but mostly fiber through natural fruits and vegetables. So make sure you are eating 2 to 3 servings of fruits and vegetables with every meal. 2 to 3 servings of fruits and vegetables with every meal. And I usually tell patients, start off with 1 liter of water. First thing in the morning. This is actually an anesthesiologist friend who gave me this tip that has worked exceptionally well on all my patients. Start off with 1 liter of lukewarm water before you do anything at all for the rest of the day, and just drink that straight down in about 15-20 minutes. And that really stimulates the bowels to move because you want to wake the bowels up. A lot of people will use coffee. The problem with caffeine is that it dehydrates you after a while. So although it makes you go, it also reabsorbs a lot of water and dehydrates you. So two simple tips: 2 to 3 servings of fresh vegetables with your meals every day, every single meal, even breakfast. You can find a way because you can make a smoothie. And then number 2, guzzle down that 1 liter of water in the morning. 2 very simple tips for you to do. Now, if it's hard for you to get that fruits in every day, 2 to 3 servings because of your work or whatever, then I say at least 3 teaspoons of flaxseed or chia seed mixed with a meal every single day. That should give you an additional 6 to 8 grams of fiber. And most people don't know this, but the average person, the average woman needs about 25 grams of fiber a day. An apple has 3 grams. So imagine how many apples you have to eat. The average guy needs about 30 to 35 grams of fiber a day. So that's a lot of fiber. And in today's American diet, what we call the sad American diet, we're not getting enough of that. So fiber is key, water is key. Let's talk about some alternatives that your gastroenterologist should look into when you have constipation. So just some basic things that could be reversed, right? And should be worked up. So it's important that we make sure you don't have a thyroid issue, right? Because thyroid issues can lead to slow transit, which leads to constipation. So that I always do that detailed thyroid panel, checking for Hashimoto's disease. And if anything is identified, once the thyroid is fixed, constipation gets better. Number 2, celiac disease. We have patients who present not with diarrhea, but just with constipation. They either have celiac or they have a gluten sensitivity. So your physician must absolutely check for that, especially if you've had constipation for a long time. So guys, we're digging into rarer causes of constipation that your GI doc should look into, and what we always do at the office of Dr. Vivian Asamoah to make sure we're not missing a diagnosis. You want to look at bacterial overgrowth, an entity called SIBO, because methanogenic overgrowth, which is a type of SIBO, is because you have specific strains of bacteria called methanogenic bacteria in your gut that slow everything down. Okay, so we said rule out celiac, rule out gluten sensitivity, make sure that you don't have a thyroid disorder like Hashimoto's, rule out SIBO, dysbiosis, rule out candida overgrowth. So get a good history from the patient. You know, someone who has had a lot of yeast infections, a lot of skin infections, recurrent yeast, it could be candida slowing things down in the gut. So those are some common reasons and common things that we should look at before committing you to a prescription medication for a long time. 3 foods that I always tell patients to get off when they have constipation. Just try and minimize these foods: bread, red meat, and dairy. Dairy is a big one because that segues into our conversation of food sensitivities. A lot of people who have dairy sensitivity, not lactose intolerance, but actually casein, dairy sensitivity, will have constipation related issues. We see this very commonly in children, right? Kids who just, they drink milk, they're crampy, they can't have bowel movements. Once we pull the dairy out of their diet, perfect. So dairy is definitely a big one. And so when we do all of these things, and we've checked for all of the things we discussed earlier, and we're still not identifying anything, then I talk to patients about doing a food sensitivity test. This is not perfect science, but it helps guide us in trying to identify if there are any major food sensitivities this person may have. And more often than not, eliminating these foods helps restore regular bowel movements. So a few tips from the office of Dr. Asamoah, few things that I do in my practice when patients come in with constipation, and I absolutely do not want to put them on laxatives, or I'm trying to get them off laxatives. I'll use magnesium hydroxide, magnesium citrate. I go all the way up to about 1,400 to 1,500 milligrams. I let them take it at bedtime. And very often that is a game changer for a lot of people. There are specific brands that I use because they're a lot cleaner. And if you want more information about that, please send me a message in the comments and I'll DM you some information. I always challenge them with some vitamin C. So I'll do a high dose vitamin C flush, and that typically helps. I will go all the way as to using, if I can, castor oil massage packs on the abdomen. As a functional medicine provider, I do a lot of visceral manipulation. I will refer out for visceral manipulation, which is basically abdominal massage of the abdomen to help the bowels move, because we see a lot of scar tissue in our patients who've had either a lot of surgery or endometriosis who suffer from terrible constipation. So that visceral manipulation, visceral massage, and we have some great physical therapists who can help you with that, helps stimulate the bowels to move and help with constipation, right? What else do? I use Triphala, which is a natural botanical, and I'll go up to about 2, 3, 4, 5 pills. It's not a laxative, you don't get hooked on it, but it helps ease bowel movements. And for some of my very challenging patients, I'll go with high dose probiotics. I've used things like Visibiome, almost about 100 million to 100 billion in probiotics will automatically change the course for patients and allow them to have regular bowel movements. So sometimes when I do that in conjunction with an elimination diet, we kind of restore the gut microbiome and they're having regular bowel movements again. So that's something else that we do. I have had challenging patients in whom I've done coffee enemas, and it has worked exceptionally well. Coffee enemas will work well, especially when you're plugged up. And I prefer that to using fleet enemas, okay? Not hot coffee, lukewarm coffee works extremely well. So those are a few tips and secrets from me to you in how to manage your constipation. But again, as I said, getting to root cause analysis is always the way to go. Because when we figure it out, you may not need anything but a healthy high fiber diet, and that may be good enough. Again, this is Dr. Vivian Asamoah. Tonight is Gut Over It, our February series, talking about an important GI topic that you must discuss with your primary care doctor. And I will be doing this every night till the end of February. I will use this to launch our private Facebook group, Natural Gut Relief, and I'm very excited. We have a lot of great things stored. So once it is up and live, I will let you guys know so you can all join. And, we hope to get back to clinic very, very soon. We miss everyone. Thank you for joining in. Thank you for leaving a like, sharing some love, and leaving some comments. Share this with someone you know has constipation and who really needs some GI help. 2 small tips. I always have 2 little things to share. One thing is when we talked about pelvic floor therapy, I wanted to mention that a very pelvic floor dysfunction, I wanted to mention that a very, very good solution to that is biofeedback therapy. This is done by pelvic floor therapists, and they almost kind of teach you how to have a bowel movement again, syncing the brain and the mind. So that's something that if pelvic floor dyssynergia is an issue, your GI doctor must tell you about biofeedback therapy. We have some great therapists in the Houston market, and they have done wonders with a lot of my patients. All right, I had to share that last tip. Guys, have a wonderful rest of the week. I see sunshine coming very, very soon. Hang in there, guys, and we'll be back tomorrow night. Bye-bye.